I'm here with Dr. Bruce Brown, a board-certified chiropractic medicine. Dr. Brown, can you please tell us a little bit about how you treat your patients here and the different modalities you provide?
The doctors here at Sugar Creek Chiropractic, we use our hands for our adjusting techniques. We use cox flexion distraction for decompression of the lumbar spine. We do full spine adjusting. We also adjust the extremities with diversified methods. We use soft tissue techniques as well as deep tissue massage and various and sundry physical therapy modalities.
Thank you. And regarding the case of Mark Teddens, can you recap his condition when he came in and what the problems were from the auto accident from July 24th?
Yeah, unfortunately Mark was driving his vehicle through an intersection when he was, the term would be T-boned onto the passenger side. He was aware right at the very last instant that there was going to be an impact, so he, in his own words, twisted to protect his son, twisted toward the impact. As a result of that impact, Mark presented with if you can picture from the side getting impacted, Mark had a lateral listhesis somatic dysfunction, which means basically the pelvis and the lower three lumbar motor units have been shifted from right to left in that lower lumbar spinal lumbosacral motor unit area with the pelvis. As a result of that shifting, the vertebra complex up, the motor units complex up, had spiraled to the right side. So from about L3 up to the thoracolumbar junction, there was a spiraling of those motor units. As a result of the spiraling and the lateral listhesis to the contralateral side, there was muscle spasm along the paralumbars on both sides. Obviously the protective mechanism that the body had instilled innately for Mark to be able to walk and move, even though there was a significant amount of pain involved.
And then the car, of course, flipped, and we landed on the other side, on the driver's side. What did you see based on the neck then in the upper spine?
It was described by the patient that as the car flipped, there was a compression load from the head down through the shoulder area as he was hitting into the door jamb, into the door framing and the side door. So what we found there was that as a result of the compression, the forces down, that would affect the facet joints and the uncovertebral articulations, zygapophyseal articulations of the cervical spine, the mid-thoracic spine, as well as the scapulohumeral joint, which is the scapula joint, on the back side on that left side. Unfortunately, because of the muscle spasm at the cervical thoracic junction, Mark was suffering with some neuritis, some acute neuritis coming off of the lower cervical brachial plexus from C5 down to about C7, involving the C8 nerve rootlet. He was having some neuritis down the back of the tricep and in under the shoulder blade.
So Dr. Brown, how did you treat Mark?
We started Mark pretty aggressively right away with cox flexion distraction for his lumbar spine. We did diversified adjusting of the pelvis and the lumbar spine. We continued to move up with diversified adjusting of the mid-thoracic motor units, the shoulder girdle, as well as the cervical spine. We did some manual cervical tractioning to decompress the facets at the cervical spine. We also did a lot of soft tissue work with the musculature. We recommended that Mark follow up with deep tissue massage therapy. We're going to include that as well as adjunctive care for his car accident injuries. We also started him very lightly the first week as far as stretching, some stretching exercises, real light core exercises. Mark had a very positive response soon after we started the therapy and the chiropractic care. He's very motivated to return back to the gym, and we used that to our advantage to actually get him back to the gym with moderate lifting, moderate range of motion, but really focusing on the axial skeleton as well as the core musculature, not only to re-strengthen and re-educate the injured soft tissues, but to stabilize the injuries that we were treating skeletally.
So, Dr. Brown, Mark went back into the gym and started working out and started feeling stronger and building strength in his shoulders, back, arms, etc. And he presented you with Grip4orce grips and stated that his shoulder and traps and that whole affected area from the accident were improving and getting dramatically stronger by use of these. Can you explain why you think that is? And you've had an opportunity to use them yourself and kind of just talk about how you think Grip4orce can help in the rehab.
Well, in Mark's situation, the reason the Grip4orce was probably so much advantageous for him is because if you think of the arm as a chain of movement from the fingers, the wrist, the elbow, all the way up to the shoulder and cervical thoracic junction, what Mark was starting to feel was that while the muscles were injured at that time, returning him back to the gym, when he started using the appropriate techniques for lifting, not overlifting, not bodybuilding weightlifting, but more range of motion lifting with a lighter weight that he could take through a full range of motion. Using the Grip4orce product basically helped him continue to be more efficient with the training of the muscles that we were attempting to specifically strengthen, rather than having the whole arm be involved in that movement. The musculature in the forearm and in the wrist and in the wrist extensors and wrist flexors are being activated, which helps release, it's a neurological inhibition of the upper shoulder, which now allows that complete range of motion, which allows that neuromuscular re-education through the range of motion that we're looking for.
So you had an opportunity to use these in your own workout routine, and you ski competitively, water ski competitively. Tell us a little bit about your experience using these things.
I'm actually a little embarrassed. I thought my grips and my hands were strong based on what I do for a living. Halfway through the workout, I had to quit using them. My forearms were blown up. I could not grip anymore. So I had to take them off and reuse them. Now I've had the occasion to use them on several other workouts since. And my forearms and the musculature from the elbows and the shoulders, the arms have just, it's a new different feeling that I've had, and I've been in the gym for several years. It's just a different, more powerful feeling that I have when I'm gripping the weights, gripping the TRX movements, the bench, the barbells, even on weight machines I'm using them. And the forearms and the shoulder muscles from the deltoids down, the traps down and into the forearms are just, they're pumping with blood, getting different inputs from the wrists, the fingers. Any type of elbow pain that I was having, this is late season for competitive water skiing, so it's very common to suffer with elbow pain on the lateral epicondyle or the medial epicondyle. And I skied yesterday 3 sets at deep short line, and I have nothing. I have no pain, no ache, nothing that I would be considered a normal type of residual pain following that type of workout.
That's awesome. Dr. Brown, based on personal injuries you see coming through your practice, do you see some applications for the Grip4orce grips?
Definitely, absolutely. This product here, the Grip4orce, would be very much recommended in an upper extremity injury, wrist strengthening, finger and interosseous musculature strengthening, dexterity. Also for the application of lateral epicondylitis and medial epicondylitis, which is best known as tennis elbow and or this would be the golfer's elbow. Also for the re-education and range of motion exercises that we've talked about for the shoulder girdle, the rotator cuff musculature, the anterior and posterior girdles of the shoulder. Absolutely, I think this would be a great product to have a patient take home with them and utilize in any type of reconditioning, rehabilitative exercises post-injury, post-surgery, whether it be for carpal tunnel, some type of surgical procedure done on the elbow or shoulder. Definitely think this would be a very, very highly recommended piece of home therapy that they could utilize.
Dr. Brown, thanks so much for your time.
You're welcome.